Okay, I have the chart pulled up for Cam Casey. Date of birth is 1/29/19XX. He is a full code. He has no allergies. Looking at the orders, there is a order to place a NG tube to low continuous suction, and I'm going to go to the imaging. Let's do. So it looks like they had a CT done earlier of his abdomen. Looks like he has a dilated bowel loop consistent with small bowel obstruction. So that is the reason for the NG tube placement. So I'm gonna grab my supplies and head into the patient's room. Okay, knock knock.
Come in.
Hi, my name's Heather. I'm gonna be your student nurse. Is it okay if I use your bedside table to place my belongings on?
Oh, sure.
Okay, thank you. Just gonna set my computer right here. I'm gonna do some hand hygiene, provide privacy. Let's get my area a little situated. Okay. Do you mind just confirming your name and date of birth for me?
Cam Casey, 129XX.
Okay. Cam, do you have any allergies?
I do not.
Okay, what about allergies to latex or adhesives?
Nope.
What about betadine, iodine?
Nope.
Okay, what about any foods, the environment, or medications?
Nope.
Okay, perfect. So it looks like your CT scan came back showing that you have a small bowel loop obstruction or small bowel loop consistent with a bowel obstruction. So we're going to place a NG tube. Have you had one placed before?
I don't think so.
No? Okay. So what we'll kind of do is I'll get my station set up. I'll do a couple of assessments. Then we're going to measure the NG tube, and then we'll insert it into your nair. It's going to go down through your throat into your stomach. We're going to place it on a low continuous suction to kind of pull out the gastric contents in your stomach. So I'll kind of talk you through more about the process as we approach it. Do you have any questions before I begin?
I don't think so.
Okay. So then I'm just gonna get my area set up a little bit. Alright, so first thing I'm going to do are a couple of assessments. So I'm going to do some hand hygiene. And I'm just going to get some gloves. And is it okay if I pull down your blanket to expose you?
Sure.
Okay. I'm just going to pull this down, and I'm going to lift up your gown to see your abdomen. Well, let's get this raised on the other side. Okay. All right, so first I'm just going to assess the skin. So looking at your abdomen, I'm not seeing any lesions, any redness, any skin breakdown, any scarring. Assessing the roundness, it looks like there is some roundness, could be distension. So then I'm going to auscultate for bowel sounds. I'm going to start in the right lower quadrant, and I'm going to listen for 1 to 3 minutes. Okay, I hear a bowel sound, so I'm going to move up to the right upper quadrant. Okay, listen for 1 to 3 minutes. Okay, I'm not hearing any vowel sounds, so I'm going to listen for 3 to 5 full minutes. Okay, so it looks like their vowel sounds in the right upper quadrant are absent. So I'm going to move to your upper left quadrant and listen. I'll listen for 1 to 3 minutes. Okay, I hear vowel sounds, so I'm going to move down to your left lower quadrant. Listen for 1 to 3 minutes. Okay, and I hear vowel sounds as well. So I hear vowel sounds in all quadrants except the upper right quadrant. There are absent vowel sounds that can be consistent with a vowel obstruction. So I'm just going to gently palpate on your abdomen. Let me know if you feel any pain or discomfort.
It's a little tender on that last spot you touched.
Oh, so sorry. Okay, so I do feel some pressure and distension. And you said you had some pain over here in the upper right quadrant.
A little bit.
Okay. And how would you rate that pain on a scale of 0 to 10? 10 being the most pain, 0 being no pain.
Like a 4 or 5.
4 or 5? Okay. And how would you describe the pain? Is it throbbing, sharp, stabbing, radiating?
It's kind of sharp and a little radiating.
Okay. And when was your last bowel movement?
It's been a few days.
2 days? Okay. What would you say your typical bowel movement weekly would be? Are you having one every day, one every other day?
I usually go about every other day.
Every other day?
And it's usually a little hard, but not as hard as it's been.
Okay. And then when you did have your last bowel movement, was it pretty normal? Was there anything abnormal about it?
It was really hard to push out, and it seemed a little hard in consistency.
Okay. And it was painful to push out, you mentioned?
Yeah, I've been having some cramping when I try to pass.
Okay. And then what's your diet consist of on a daily basis?
I probably eat too much dairy, but other than that, I usually eat a pretty good diet. Try not to eat too many sweets.
Okay.
Love that steak and potatoes, and I do love green beans and salad.
Okay.
Not too much into fruit.
Got it. And then are you currently taking any over-the-counter medications like a stool softener or something for constipation or like extra fiber supplements?
No, I think I probably should though, huh?
Well, we can definitely look into that and see if we can give you something to help. Are you able to pass gas, or have you passed gas this morning?
I don't think I have now that you bring it up.
Okay. Okay. So then I'm just going to move to your respiratory. So I'm just going to get you raised a little bit. Okay, go ahead and lean forward, and I'm just going to get your pillow a little bit more under you. And so I'm just going to assess your respiratory effort. Your breathing, it looks like it's symmetrical and even. It is unlabored. Are you experiencing any difficulty breathing or shortness of breath at the moment?
Nope.
No? Okay. So your respiratory effort is good. I'm just going to pull down your gown and expose your chest briefly, if that's okay. Okay. So I'm just going to assess the skin, I don't see any redness, lesions, skin breakdown, discoloration, swelling, lumps, bumps. So then I'm just going to listen to your lung sounds. Go ahead, take a deep breath in and out. Okay, again, in and out. Okay, again. Okay, one more time. Okay, now listen to the lungs on your side. Go ahead, deep breath in and out. Okay, and one more time. Okay, good. And then did you feel any pain or discomfort with your breathing at the moment?
Nope.
Okay, I'm just gonna have you lean forward. And
Do you need my help?
I think I got it.
Okay.
Okay. So I'm looking at your back. I'm just looking for your skin assessment. Again, I don't see any redness, swelling, discoloration, bruising, skin breakdown, lumps, bumps. So I'm just gonna prep you a little bit with a pillow, have you lay back, and then I'm just going to listen to your lung sounds in your back. So then go ahead and lean forward. Okay, take a deep breath in and out. Okay, and again. Okay, one more time. Okay, one more time. Perfect. Okay, go ahead and lean back. Okay. Looks like your lung sounds are clear bilaterally, so I'm not hearing any wheezing, crackles, any hoarseness. Don't hear any bronchi or stridor. You don't have any shortness of breath, any difficulty breathing. Assessed your chest effort, your breathing rate. Everything looked good, and I'm just going to assess your nasal passage. So let me get my pen light. Alright, so I'm just going to look at the nose. The nose is midline with the face. I'm just going to take a look inside. I don't see any polyps. I don't see any deviations. I don't see any redness, any discharge. Go ahead and open your mouth. Okay, perfect. The uvula is midline. I don't see any redness or any inflammation or swelling in the mouth. That looks great. So then we're just going to check your nose for patency. So I'm just going to have you use a finger, plug one side of your nose and take a deep breath in and out. Perfect. And then do the same for the other nose. So close the other side, deep breath in and out. Okay, so it sounds like that both nasal passages are clear. So I'm going to use the right nasal passage for my insertion of the NG tube. So then I'm just going to change my gloves and get my area set up. Let's get you a little bit lowered. I'm just going to drape a towel across. It can get a little messy, and we just don't want to get any lube on your gown. And I'm just going to get my tape. See if I can move this out of the way. So the first thing we're going to do is measure the tube. and I have my packaging, my Salem Sumpt tube. It is a 12 French dual lumen, and the packaging is intact. It is not expired. It is latex free, which isn't a problem since there is no allergy latex for our patients. And then I'm just going to open my packaging. Okay, so then I'm just going to get my tip. So I'm going to measure from the tip of your nose to the tip of your ear. And then from the tip of your ear down to your xiphoid process. Let's see, and it looks like we're about a 70. So I'm going to take my tape and then get this marked at the 70 line. Okay. So the next thing I'll do is I'm going to lube up the tip of the NG tube, and then I will have you tilt your head back and I will slowly insert the tube in your right ear. When I hit the back of your throat, I'm going to have you tilt your head forward and take some small sips of your water while I continue to insert the tube until we hit your stomach. At any point, if you feel any pain, discomfort, if you feel nauseous, if you feel like you're going to vomit, just go ahead and raise your hand up for me, and then that will signal me to stop, and then we'll just take a beat and then let you kind of work through what you're experiencing. Do you have any questions for me at the moment?
I don't think so.
Okay. All right, so then I'm just going to lube this up. All right, and then I'm going to give you your cup of water. Okay, so I'm just going to have you tilt your head back. Okay, you ready?
Yep.
All right, so I'm inserting. Okay, and then we are at the back of your throat, so go ahead and tilt your head forward and start taking small sips of your water. While I'm inserting, I'm assessing for any gagging, any signs that he can't hum or talk or speak, any signs that he's becoming cyanotic, turning blue. And so if you start to experience any discomfort or pain, it's okay. We'll go ahead and take it slow, reassuring the patient. We are almost there. You are doing great. All right, and keep taking some sips of water. We are right there. Perfect. All right, so I'm just going to go ahead and temporarily get this marked. Okay, I'll take your water. How are you feeling? You doing okay?
Yeah, I'm doing okay. Thank you.
Good. Okay, there was no vomiting. There was no, patient was able to speak. He wasn't able to hum. Didn't have any shortness of breath. No gagging, no vomiting. He did not raise his hand. He wasn't turning blue. Was able to insert without any issues. So then I'm just going to go ahead and take out a sample just to make sure we are in the right spot. Okay. We're just going to take out some of your gastric fluid. And then I'm just going to test the pH. So it looks like we're about a 4 for our pH, which is appropriate. We are in the correct spot. So then I'm going to discard and change my gloves. We're going to get a better securement. Are you still doing okay so far?
Yeah, thank you.
Okay, good. We are almost done. So I'm just going to get this secured to your gown for just a temporary placement until we can get X-ray to come in. Okay, so we have that on there, and then X-ray is going to come in. So X-ray comes in, they do their imaging, they leave. Okay, so it looks like X-ray confirmed that we are in the correct spot. We are in your stomach, we are not in your lungs, which is perfect. It's where we want to be. So I'm just going to get the permanent taping on. So let me get my Sharpie to mark on the tape. We're going to do a skin barrier. Get your nose cleansed. Okay. I'm going to get that on your nose. Don't want to cover your entire nose. Okay. And I'm just going to mark it one more time since we went over that last marking. Perfect. Make sure that is on. Okay. All right, and are you still able to breathe okay?
Yeah, thank you.
Okay, perfect. So then I'm gonna go ahead and just remove this for right here. So we want to set this up to low continuous suction. So go ahead and put on new gloves. I'm just going to unpin this from your gown. Bring over our suction, and so you're just going to hear a loud suction behind you, which is what we want. It's going to be on a low continuous suction, and it's just going to empty the contents of your stomach. We'll just want to make sure that machine is on constantly. Okay. Let's get this turned on. All right. So it looks like it is starting to pull your contents of your stomach, which is great. That's what we want. And so I'm just going to change my gloves. and then give you some oral care. And since we didn't contaminate the towel, we'll go ahead and just continue to use the towel for your oral care. Okay, I'm just gonna cover you. Alright, I'm gonna dip the tooth bed into the other cup of water. And just pretend that. Go ahead and take some sips of water. And then I'm just gonna go in here and scrub your mouth. Okay, go ahead and take some sips of water and then spit. Perfect. Get you. Okay, and that should be the end. Is there anything that I can do for you before I step out?
I'm okay, thank you.
I'm just gonna get the bed lowered. We're gonna keep you in this semi-Fowler's position. You have your call light. I'm going to remove the privacy curtain. Get my supplies. Make sure you have your bedside table. Get that lowered. Onto some hand hygiene. Okay, go ahead and give me a call if you need anything.
Okay, thank you.